Hello, this is Bob Dennis, and on my first full day of self-imposed quarantine here because of the coronavirus and my potential exposure to it. Long story, but better safe than sorry. So con- why would I confine myself if I've already been exposed to the coronavirus? I mean, gee, if you're already exposed, you're already sick, right? So why not just go around, do whatever you want to do? Well, a lot of people don't seem to understand what's going on with the coronavirus. I don't fully understand it. I don't think anybody does, but I do understand some parts of it. Some of it involves, epidemiology and calculus, and it's a little bit complicated and you know, policy and advice are informed by some scientific input that might not be clear to the average person. So I'd like to take some information that I think comes from a very reliable source, and I'd like to tell you why it is you're being told to not go to public gatherings and why we're thinking about keeping children away from public places like schools and why it's important to think about doing things like working from home. It's all about containment of the virus, but what does that really mean? So I just want to kind of go through that and tell you what that actually means from the standpoint of a scientist. So let's get this clear. I am a scientist, I'm an engineer, but I'm not a virologist, and I am not a specialist in public policy. And I do not want to contribute to the many non-helpful misinformation discussions going on. I just simply want to talk about what's provable, factual information based upon what I think is really good, sound scientific advice coming from really reliable sources. Okay, so let me tell you. Today I saw what I thought was an extremely intelligent graphic. That was called Flattening the Curve, and it was on Vox.com. And they were talking about the importance of taking protective measures. And many people can just look at this curve and sort of intuit what they're talking about. But the curve is actually a little bit misleading, because if you actually do some calculus and you measure the area under the curve, this information suggests that if you protect yourself and isolate yourself, that fewer people will get infected. And actually, I don't believe that's true. And actually, there's some really smart people who agree with me that think that no, a lot of people are going to get infected no matter what you do. So it's controversial. Why take protective measures? Why shut down all these public activities and travel and all this stuff? And so I'm going to represent this same information, but I'm going to represent it in a way that I think is more mathematically correct and epidemiologically correct, scientifically correct. And I also think it's going to be simpler and easier for everyone to understand. So first, I want to give credit for inspiring me to do this. This originally came from the CDC, the Centers for Disease Control and Prevention, the United States government. So I'm not going to say anything that they haven't already said. If you want to see this original graphic, it's posted on Vox.com, and I give the link information right on this slide. But let me move on to an explanation of this, because what they're talking about here is the number of cases that you get reported every day, or that happen every day. What's important is the number of cases that really happen every day versus time, days since the infection starts. Okay, so I think the other important piece of information to have, and these two things need to be put together to really make this make sense, is something that Chancellor Angela Merkel said. Chancellor Merkel from Germany, she's very straightforward, and she just simply did something that typical politicians don't do. She just told the unvarnished truth as she understood it. She said to her people, 60% to 70% of the population will be infected by the coronavirus. Doesn't matter if you hide in a hole somewhere, doesn't matter what else we do. The current belief is that 60 to 70% of the population is going to get infected. Doesn't matter how much we quarantine people. That's probably true. In fact, I've heard numbers that are as high as 85% infection rate, no matter what we do. So if everyone's going to get the virus anyway, why would we bother taking protective measures? And that's the key message here that I'm trying to kind of get across to people that I think would be helpful. So I'm trying to add a little tiny something to the conversation. So let's break this down and look at it. On the left, in the vertical axis, you can see number of people. That's the number of people every day that are infected by the virus. And then on the horizontal axis is time. You can think of that as day 1, day 2, day 3, and that time scale might go out for a couple of months, okay? If we do absolutely nothing, then basically we have this huge buildup to a maximum infection rate where we get the maximum number of people infected. And then eventually what happens is you just simply run out of people and you get fewer and fewer people infected because there's really nobody left to infect. You kind of only get this virus once as far as we know. Then you're either you succumb to it or you have resistance. So, but the point here is that it happens all at the same time, basically. And this is what we're seeing in places like Italy and in China before it started to get controlled. You get huge numbers of people because of social behaviors, going to large meetings, going on public transport, schools, and so forth. They get infected very, very quickly. This is a highly virulent virus that just basically takes almost nothing. Apparently, takes very mild contact to transfer it between people. But the key here is, what's the effect of isolation and protective measures? So what I'm going to do is say you do a little bit of protective measures. Now the original curve, I'm going to leave it in gray, and that will show you if you do absolutely nothing, no protective measures, that's how quickly people get infected. Now you can get the same number of people infected, but it takes a little bit longer if you're just a little bit careful. You cough into your elbow. You don't sneeze on people. All right. If you're a little bit more careful, you wash your hands all the time. All right. You don't cough on people. It takes a little bit longer for people to get infected. So for those of you who know that I'm a nerd and understand some calculus, the point here is that correctly the area under the two curves is the same. So you're getting the same number of people infected. It's just that it's happening over a longer time. So on any given day, you really don't get as many people infected, especially as the disease is building up, as you would if you did nothing, right? If you wash your hands properly for 20 seconds or longer using warm water and soap, maybe you slow the virus down some more. You keep adding protective measures and it slows down some more. Notice the area under the curve stays the same. The total number of people infected over time, over the long run, that's the same. So you're not preventing any cases of coronavirus infection. What are you doing? You're slowing it down. As you have increasingly effective protective measures, the rate at which the infections occur slows down, and that means the peak number of infections on any given day is reduced. The infection period lasts longer, but how quickly it happens is drastically slowed down until eventually you get to the point where it's the same number of people infected, but it's spread out over a much longer time. Why does that matter? Here's why. This is why you need to follow really good public advice, which we're getting really basically very good public advice, especially if you take anything from the CDC. They're going to, as far as I know, the CDC doesn't have any kind of negative biases. Maybe they do, but everything I've ever heard from the CDC just makes tons of sense, very scientific, and all you have to do is take the time to figure it out. So what the CDC is asking people to do is help slow down the spread of the virus. This is why. If you do nothing, no isolation, no quarantine, no protective measures, you get a very large peak number of people infected, and it happens very quickly all at the same time. If you allow quarantines, on the other hand, and instead of looking at the gray curve, which is just everything's out of control, you go to the red curve and you use quarantine and protective measures carefully, then you get a much lower peak. So you get on the worst possible day of the epidemic, of the pandemic, you get fewer people infected. So this is the key message here. If you do protective measures, you're still probably going to get the virus. So you just get it a couple days or weeks later. You and many millions of people will get it a few days or weeks later. And this is why it matters. The same total number of people are likely to be infected, but not everybody at the same time. It's sort of like, it's cool for people to retire, but you don't want every single person in the workforce to retire in the same day. You got to spread things out over time. Okay. So when you get the peak number of people infected way down, the benefit you get is that the medical system has the opportunity to build capacity so that it can take care of those people. So if you let everybody get infected all the same time, all early in the pandemic process, your peak number of infected is way above the maximum capacity of the medical system. However, if you spread it out over time, then you're going to have fewer and fewer people infected on any given day, which means that there is more and more of a chance that the medical system will actually be able to accommodate them. Now, this is very close to the graph that people are starting to circulate now that's based on the CDC, but I would say the maximum capacity of the medical system is actually going to increase over time, right? So you are, by delaying the onset, you're actually allowing the medical system to increase and catch up with the demand. But if you don't do anything and everybody gets sick at the same time and they all get sick really soon, medical system's never going to keep up. So it's not just a matter of reducing the peak. Reducing the peak's a very good thing. All right, but it's also a matter of lengthening the time, because if you do nothing, then you get the upper left green dashed line, which means everybody gets sick at the same time in a very short time. Medical system has no time to respond. But if you allow the medical system to respond more time, you can have more capacity with a lower peak, which means we're all likely to get better health care. And I can tell you that if this virus is as serious as people are saying it is, then there's a reasonable chance that there's going to be very long lines of people being turned away from hospitals. There just simply won't be enough beds. There won't be enough ICU units. There won't be enough respirators. There won't be enough healthcare providers. There won't be enough basic supplies, gloves and masks. So the longer you allow the system to build up, the better the system will serve you. And that's why you're taking protective measures. You're not taking protective measures now because you're going to prevent yourself from getting the virus. You're taking protective measures because you are going to extend the time that it takes for you and everyone else on average over millions of people, maybe billions, to get the virus. And that's going to give the medical system time to build up capacity to be able to serve everybody better. Now, if you go back and look at this graph, I wouldn't say the maximum capacity of the medical system stays the same. I would say that the green line is going to actually increase over time. So as long as you're allowing more and more time, you're allowing a bigger and better and stronger medical system to take care of a lower and lower and more delayed peak. And that's what we want to do. So this is what I'm advising people to do. Therefore, be smart. Flatten the curve. Everybody should be saying that. That's the mantra. Flatten the curve. Let's not all get infected at the same time. Let's stretch it out over the longest possible time. Slow down the rate of infection and take protective measures as advised, because right now we're getting very, very good public advice on how to do this. And we're getting some key politicians making very, very good political decisions and policy decisions that will help us do this. But we all just have to suck it up and do everything we can to follow that advice and stretch this out as long as we can to give the system time to catch up and build capacity and better serve everyone. So I hope that was helpful. I hope that explains to you why it's so important to follow this public advice, because you're going to be helping not just yourself, but everybody else on the planet, whether or not you get infected right away. The more you delay it, the better. Okay, thanks.